ready.
I'm ready as I'm gonna be.
There you go. Well, thank you for doing this. We really appreciate it.
Sure.
You know, as we try to get awareness out in the community, I think the digital world it becomes more and more important, and
Yeah.
so we're gonna try to get out there into it.
Good, good. That's where people get their information.
It really is, yeah.
Yeah.
And so I think we did a lot over the last year to help out, but there's still so much more we can do.
Good, good.
So if you wouldn't mind telling us your name, how long you've been with Goodson Cares, and what you do here.
All right. Well, I'm Pamela Richardson. I'm a physician, and I'm the chronic disease physician here and have been for 15 years. I grew up in Louisa County and went to medical school in Norfolk and did my internship at VCU and came back to Louisa and practiced medicine there for many years. It reached the point that every night when I drove home, there was this voice in my head saying, "This job is killing you." And a few months later, I found out I had breast cancer. And so and that was 26 years ago, had treatment for breast cancer and decided not to go back into private practice. Spent a number of years at home. Then I taught preschool at Providence Presbyterian Church, but there was something in me that still was looking for a meaningful way to be engaged. And so I came to Goochland Fellowship, talked to a member of our church about their adult education program, and she said to me, "Dr. Richardson, they might could use you at the medical clinic." So I met Sally Graham, and my life changed. I really found again my calling for medicine. This was what I dreamed about when I dreamed about practicing medicine, about having plenty of time to be engaged with people, to be able to love them and care for them and give them excellent medical care, but at the same time have them feel like they were seen and known and important as individuals. They weren't just appointments on a schedule. And so I came over here one Tuesday night for clinic, and I was terrified. It had been 7 years since I practiced medicine. My throat was dry. I was having hot flashes. I was terrifying, and I just found my home. So at that point, we had a nurse practitioner doing chronic disease clinics, and she moved, and so Sally said, "Would you like to do that?" And I said, "Sure, just pay me a nurse practitioner salary, I'll be happy with anything." And Bon Secours, who's been providing support for the nurse practitioner salary, said, "Oh, we'll pay her physician salary." So anyway, here I am 15 years later, and seriously beginning to think about retiring again. You may want to edit that out. But it has just been wonderful. It has been wonderful. And as I tell patients, we have time for them here. They're not going to be rushed through a 10-minute appointment. We'll listen to all of their problems. And what we often find out is that when we get past the acute complaints that people feel like are okay to talk to their doctor about, then we get to what's really going on inside of them. And fortunately, we have lots of other services other than medical care to provide. So this is whole person care here. This is not just medical care here.
That's great. So you've been here a long time. I'm sure you've seen both the county and Goodson Cares grow in that time. Any thoughts on that?
Well, the biggest transitions have been, in the COVID years and post-COVID years, because for a long time in Goochland County, the only people who qualified for Medicaid were pregnant women, and then the first year after their babies were born. I mean, men never got Medicaid in Virginia in the old days. And so with the expansion of Medicaid, when COVID came, we saw many, many of our patients, probably over 50% get Medicaid. So our patient population contracted dramatically. But what we were seeing at the same time was that our Hispanic population as a percentage was increasing. And that has just been such a joy for us to see this population, new to Goochland, new to this country, come to trust us and to know that they were safe with us and that they would be heard and listened to and taken care of here. And so that's been our growing edge. Now, as the COVID expansion for Medicaid has ended, we are seeing our Medicaid population come back. And so it's wonderful to see these folks again that we haven't seen for 2 or 3 years. And it's wonderful that they know they've got a home to come back to. They've got a family doctor to come back to. And so they're not just cast out. So yeah, the last few years have been the big changes.
So, being a kind of a volunteer-driven organization, how does that affect the medical office?
Right. Well, I'm the only paid physician, the chronic disease physician. So we have many volunteer physicians here. Our medical director is a cardiologist and he sees patients regularly. We have a kidney specialist who for a while was the head of the kidney department at VCU. I think he's happy to no longer be that, but he comes out here once a month and sees all of our kidney disease patients, and he sees them in the very early stages. He believes in screening for early kidney disease, and then he follows the patients. And we've only had a few patients have to go on dialysis because we're detecting kidney disease early and giving them effective treatment for it. So that's a great asset here. We have other family physicians who come in for Tuesday night clinic. So it's there are an array of physicians here, not just me.
Wonderful. And maybe you can talk a little bit about what happens if we have a patient that kind of is beyond our scope of services.
Right. The thing that really, we provide a tremendous amount here in the office. In addition to the physician specialties I mentioned, we also have physical therapy here. We have orthopedic specialists come in a couple of times a month. But there are times when people need more than we can provide here. Probably the most common example of that are x-rays. You know, we don't have x-ray equipment here. And so we've had a partnership with Henrico Doctors at Parham to provide x-rays for our patients. And that's been a wonderful service. We don't do our lab work here, and we've had a partnership with Bon Secours, and they provided our lab work for our patients for as long as I've been here. That's been a really wonderful partnership. I see patients, we were able to get lab work for them that they weren't able to get when they were seeing private physicians because they just couldn't afford it. And then there are referrals that we have to do outside of the services that we have available here. There's a program by the Richmond Academy of Medicine called Access Now, and they are physician specialists who volunteer to see a certain number of free clinic patients. Now there's an income limit on that, and hopefully we'll see that increase a little bit, but the demand for those services is incredibly high. Right now there's a 2-month wait from the time we make a referral through Access Now for a specialist until they even get scheduled for an appointment. So that's a part of the system that's really in huge demand and struggling to keep up, but we're thankful for what they are able to do for us and for our patients.
Yes, indeed. And so you were going to talk directly to a patient or a potential client that may be nervous about coming in, what would you say?
Well, I would just tell them that we are as interested in their health as they are, and that we're not an authoritarian organization. We're not going to force them to have anything done that they don't want to have done. And if they just want to come in and talk with us, that's great. But that if they have an issue that needs medication, we can get that for them for a very minimal charge, $5 charge for most medications. We can refer them to specialists if there's something that they need done, but they're not going to be forced or intimidated into anything they don't want to have done, and that we are going to take the time to listen to them, and we're going to honor them as individuals. And for our Spanish-speaking patients, we have wonderful translators here now. It's been amazing to see that part of our service expand. As we've gone from just being able to translate a few words, a few medicines, a few concepts, to really being able to understand every word that they say and every concern that they have. So I would just invite you to give us a try. I think you'll be very happy, and if you don't like me, there's other doctors you can see too. So this is a happy place, a friendly place, a welcoming place, a safe place.
Well, I've never heard anybody say an unkind word about you. So if you think other doctors and caregivers are nicer than you, then I think that's a big statement.
Well, people, our volunteer physicians, they're here because they feel called to this ministry, this practice. So, yeah.
Okay. Anything else you'd like to?
Let me just look at my list and see if there's something that I've missed. Oh, one of the specialists that we love is our, we have a diabetic specialist, a pharmacist who's a doctorate in pharmacy, and her assistant that see all of our diabetic patients. And I mean, patients with insurance don't get that kind of diabetic care and management. And she's right on the cutting edge. When any of these new medications comes out, she knows all about them and has assisted us in getting those medications. So that's a really exceptional part of our program that's above the common standard for medicine. And of course, there's dental. I mean, everybody hates going to the dentist, including me, but in terms of health, boy, dental health is so important. And we've got a great dental team. And nobody ever comes and complains, even though we're all terrified to go to the dentist.
Now, you mentioned something I want to follow up on, that our diabetic program is kind of cutting edge. How would you kind of sum up the environment of the medical office as kind of modern or up to date, or?
Well, we're certainly modern and up to date in terms of procedures and policies and practices and medications and diagnosis and treatment, and we're up to date in terms of all of that. But I tell you, it's like the old family doctor. When my grandfather had his stroke, Dr. Pendleton came, and sat by him on the sofa and comforted him and told us what to do. So there's a old family doctor spirit here, as well as the best medical care that you could ask for.
Anything else you'd like to share?
When people come here, not just patients, but other medical providers, members of the community, and see what's going on here, they always say, I've never seen anything like this. this is a model for care that is exceptional in our country, not just in Goochland County or Virginia, but in our country.
Awesome. Thank you so much.
Okay.
Appreciate it, and yeah, I think lots of good stuff in there, and
Good.
you know you're not allowed to retire, right? I mean, you might have to go back and read your contract, but I think at the bottom it says.
Well, that we really, I have asked that we not make that public until August 1st, just because then everybody wants to say goodbye and tell me how wonderful I am and all that, and
Well, it's
that's
gonna take that long to
painful.
do it.
That's painful, so, yeah, we are kind of keeping it as quiet as we can until then. 'Cause patients feel abandoned,
Yeah, true.
they do, but I know it's time,
Yeah, when you know, you know.
yeah,
Yeah.
yeah,
Yeah.
good, and it's in good hands, it's in great
Well,
hands.
but very large shoes to fill, for sure.
I'm confident it will happen.